Hi, I'm Dr. Darren Gitelman. I'm the Senior Medical Director for the Advocate Memory Center, which is part of the Advocate Health System, and I'm located in Park Ridge, Illinois. Today, I'm here to talk about clinical changes in early Alzheimer's disease and discuss some common signs and symptoms. Alzheimer's disease, we've discovered over the past several decades, starts long before the clinical symptoms become apparent. Models have shown in patients with genetic and also sporadic forms of Alzheimer's disease that changes in various proteins, the amyloid protein and the tau protein, begin up to 2 decades before clinical symptoms are diagnosed. The early accumulation of beta amyloid ends up forming oligomers, fibrils, protofibrils, and plaques. Several of these species along the way have their own toxicities to them. Something about these various amyloid species, as I've mentioned, leads to the hyperphosphorylation of the protein tau. Tau is a microtubule-associated protein which functions in a sense as the scaffolding or a skeleton of the neuron, involved with transport of neurotransmitters, synaptic vesicles, and so on. And so with malfunction of tau, the neuron doesn't function correctly, can't perform its role, ends up leading to neurodegeneration. The accumulation of plaques seems to also be associated with neuroinflammation, and that may additionally promote accumulation of fibrils, protofibrils, and other plaques, and further leads to the neurodegeneration in the disorder. Early diagnosis is important in Alzheimer's disease because as the changes take place, they seem to be largely irreversible. Finding people early with Alzheimer's disease seems to lead to a better outcome in terms of treatment that reduce the level of amyloid in the brain and seem to slow down the progression of the disease. Additionally, early diagnosis can lead to really opportunities for planning for the future. So we always try to encourage patients plan for the future, make financial plans, make medical plans, have a power of attorney, and these types of important decisions that can be made by people even with early Alzheimer's disease because they still have the capacity to make those decisions. There are different stages in the course of potentially developing Alzheimer's disease and other dementias. Just focusing on Alzheimer's disease, the preclinical stage is one in which pathological changes are starting to take place in the brain. The patient may or may not notice some of these changes. As the disease progresses, one gets to the stage of what's called mild cognitive impairment. So at that stage, changes in cognition are measurable, but the patient is not performing normally anymore, particularly in the domain of memory, for example, but they are still independent in their daily lives. Again, they may struggle a little more, they may be a little slower in how they approach their daily activities or problems, or if they're at work, for example, but they still get through it and they can still function fairly normally. What can people do to screen for some of those changes? I think history is always most important. Ask the patient what types of symptoms they're experiencing. Is it memory or other areas of thinking? But then ask about their functioning. That's very important. So when we look at the level of the patient or how the patient is doing overall, it's not just how they perform on a memory test, whether they can remember 3 words or 5 words, but it's also how they're functioning in daily life. Behavior is important as well, and we now recognize that there can be early behavioral changes in many of the disorders causing dementia, and not just cognitive changes. There are a number of relatively brief screening measures, so tests such as the Mini Mental Status Exam, or the Montreal Cognitive Assessment, or the St. Louis University Medical Exam. It can be difficult early on in the course of symptoms of someone who may end up developing Alzheimer's disease to detect those symptoms. In primary care, they may have a 15-minute visit. They have to go through all the systems of the body, and the patient may have their own questions. So then trying to pick up on subtle changes in memory and thinking can be quite challenging. But again, I think asking about some of the changes in cognition, asking about function, what you're really looking for are there changes that interfere with daily life? That's what's really most important.